Ever feel like a simple stomach ache turned into like a medical mystery overnight?
Mm-hmm.
Today, we're tackling those tricky situations head on as we deep dive into the world of complicated intra-abdominal infections,
Right.
guided by the latest 2024 guidelines from the Infectious Diseases Society of America.
Yeah, these aren't your average tummy troubles, right?
Right.
We're talking about infections that spread beyond their initial location,
Oh, okay.
like peritonitis or abscesses.
Yeah.
Serious stuff that requires quick thinking and accurate diagnosis.
Okay, so not just a rumbling stomach after a bad burrito.
Exactly.
We're talking about conditions like appendicitis, which, by the way, affects a whopping 670,000 people globally each year.
Wow.
It makes you wonder, how do doctors even begin to, unravel these internal puzzles
Right.
and figure out how risky the situation is?
Risk assessment is absolutely crucial here.
Yeah.
For adults, the Apache 2 score is a go-to tool.
Okay.
Imagine a detective meticulously analyzing clues at a crime scene.
Right.
That's Apache 2. But instead of fingerprints,
Yeah.
it's crunching physiological factors to predict the infection's potential severity.
Makes sense. You need some way to gauge how worried to be.
Right.
What about the WSES sepsis severity score I came across in the research?
Yeah.
'Cause it sounds pretty specific to these types of infections.
You're right on the money.
Okay.
That one's specifically designed for these infections.
Okay.
So it's another valuable tool in the arsenal.
Yeah.
Interestingly, though, when it comes to kids, there's no universally agreed-upon scoring system.
Really? That's surprising. I think they'd have something more concrete for pediatrics.
You'd think so, right?
Yeah.
It highlights how tricky pediatric diagnosis can be.
Yeah.
Experience and careful observation become even more important when you're dealing with little ones and don't have a standardized score to rely on.
A good reminder that medicine isn't always an exact science.
Right.
Now let's talk imaging.
Okay.
Like trying to find a specific star in a galaxy of possibilities. How do doctors choose the right tool for the job when it comes to these infections?
You've got that right. The type of infection, the patient's age, pregnancy, all these factors come into play.
Right.
Let's say an adult comes in with suspected appendicitis.
Yeah.
In most cases, an abdominal CT scan is their best bet.
So it's the go-to imaging test in this scenario. What makes CT scans so special?
They're incredibly detailed and accurate, even without contrast.
Okay.
Think of it as a high-resolution map of the abdomen, helping doctors pinpoint the problem area with remarkable precision.
Okay, that makes sense. But what if the CT scan doesn't give a definitive answer? Do they just, keep scanning until they find something?
Not necessarily. That's where the art of medicine comes in.
Okay.
They might recommend a wait-and-see approach, careful observation, maybe some antibiotics to see how things develop.
Okay.
Other times, especially if the suspicion is strong, they might recommend surgery, even without picture-perfect imaging.
Wow, okay.
It's about weighing the risks and benefits for each patient.
That makes sense. You don't want to, jump the gun, but you also don't want to miss something critical.
Exactly.
Now, what about kids?
Yeah.
Is it the same deal with CT scans?
Here's where it gets interesting.
Okay.
For children, we try to minimize radiation exposure whenever possible.
Right.
So instead of going straight to a CT scan, the first line of defense is usually an ultrasound.
Right. Ultrasounds are generally considered safer, especially for developing bodies. But what if the ultrasound isn't clear enough?
Right.
Do they move on to a CT scan then?
They could, but another option is an MRI.
Oh, okay.
It all comes down to balancing those risks and benefits, right?
Right.
Radiation exposure versus the need for a clear diagnosis.
It's like a medical game of chess, carefully considering each move.
Yeah.
Speaking of delicate situations, what about pregnant individuals with suspected appendicitis?
You're thinking ahead. You're right. Pregnancy adds a whole other layer of complexity.
Yeah.
In these cases, minimizing risk to both the parent and the baby is paramount.
So I'm guessing ultrasound is the preferred imaging option here as well.
You're catching on quickly.
Okay.
You're absolutely right.
Okay.
Ultrasound is often the starting point. And if you need a more detailed picture, MRI often steps in as a safer alternative to CT scans.
It's fascinating how these decisions are made so much to consider. So we've covered appendicitis in depth.
Right.
What other abdominal adventures await us in the world of complicated infections?
Well, let's talk about those troublesome twosomes.
Yeah.
Cholecystitis and cholangitis.
Oh, yeah. Those were some tongue twisters I stumbled upon in the research. They sound pretty intense.
They can be. Think gallbladder and bile duct issues.
Right.
Inflammation, blockages, the works.
Yeah.
Not exactly a walk in the park.
So how do doctors go about diagnosing these conditions? Is it the same imaging game plan?
For adults, the trusty ultrasound often takes center stage as the first line of defense, just like with appendicitis.
Okay.
If the results aren't crystal clear, a CT scan usually comes next to provide a more detailed look.
And if those two tests don't give a definitive answer?
Then it might be time to bring out the big guns, a AGA scan, or even an MIMI-MRCP.
Okay.
These are highly specialized imaging techniques that give an incredibly detailed look at the gallbladder and bile ducts, helping doctors pinpoint even the sneakiest of problems.
I'll admit, those acronyms sound a bit intimidating. I'm glad I'm not the one who has to, order these tests. But it's amazing how medical technology has advanced to offer such precise diagnostic tools.
Absolutely. It's incredible what we can see and diagnose these days.
Yeah.
But here's where it gets interesting again. For pregnant individuals with suspected gallbladder issues, the guidelines don't actually recommend a specific imaging test to use first.
Really? Why not? Don't they have enough data to make a recommendation?
You hit the nail on the head. The guidelines acknowledge that there's not enough high-quality evidence to say definitively whether ultrasound or MRI is the better option in these cases.
So it highlights how much we still have to learn and how important it is to continue researching and refining our understanding.
Exactly. It's a good reminder that medicine is a constantly evolving field. What do doctors do when the guidelines are silent?
Right.
They rely on their expertise, weigh the potential risks and benefits of each test for the individual patient, and have a conversation about the best course of action.
I love that approach. Short decision-making is so important.
Absolutely.
It's about being an active participant in your healthcare journey, not just a passive bystander.
Yeah, absolutely. It empowers patients to ask questions, understand their options, and ultimately make informed decisions about their health alongside their healthcare provider.
Speaking of informed decisions, I'm ready to move on from the imaging maze, if you are.
Okay,
What other diagnostic dilemmas did you uncover in the guidelines?
let's talk about those pesky pouches known as diverticula, or more specifically, what happens when they get infected diverticulitis. Any guesses on the imaging approach for that one?
If I've learned anything today, it's that when in doubt, start with a CT scan, right?
You're definitely getting the hang of this. You're right. For non-pregnant adults with suspected diverticulitis, an abdominal CT scan is often the first imaging test ordered.
Okay, I'm sensing a pattern here. What if, for whatever reason, a CT scan isn't an option for the patient?
Then we turn to our trusty backup singers, ultrasound and MRI.
Right.
They might not always be the headliners, but they can be incredibly valuable when a CT scan isn't feasible.
Makes sense. They're always there to step in and save the day. And just to test my knowledge, I'm guessing the guidelines for pregnant individuals with diverticulitis are a bit murkier, right?
You're on a roll. You're absolutely right. The guidelines don't provide a definitive answer in these situations.
Yeah.
They simply state that doctors can consider either ultrasound or MRI, depending on the specific circumstances.
It seems like there's a recurring theme here. More research is needed. It's fascinating how these guidelines highlight both what we know and what we still need to uncover.
Precisely. They offer valuable guidance, but they're also a testament to the fact that medicine is a constantly evolving field. Yeah. What about those unwelcome guests, intra-abdominal abscesses?
Ah, yes, those pus-filled pockets of joy. Okay, that might be pushing it. But seriously, what's the imaging strategy for those? I'm guessing CT scans are back in the spotlight.
You know it. For adults and adolescents with suspected abscesses, the guidelines recommend an abdominal CT scan as the first imaging test.
And to mix things up, I'm betting children get an ultrasound first.
You're on fire today. You're absolutely right.
Okay.
For kids, it's usually ultrasound first, followed by either a CT or MRI if needed.
See, I told you I was becoming an imaging pro. What about pregnant patients with suspected abscesses? Is it the same story as before?
You guessed it, the guidelines are silent on which test to use first.
Oh, okay.
They simply state that both ultrasound and MRI are options, and the decision should be made on a case-by-case basis.
More research needed, as always. It's fascinating how these guidelines highlight both the incredible progress we've made in medicine and the vast amount of knowledge we still have yet to uncover.
Absolutely.
Yeah.
And it underscores the importance of ongoing research and evidence-based practice in ensuring the best possible care for all patients.
Well said. I think we've covered a lot of ground when it comes to imaging, from those first-line tests to those more specialized options. What other diagnostic tools do doctors use to unravel these complicated intra-abdominal infections?
You're right. We've covered a lot of ground on imaging, But there's another crucial tool in the diagnostic toolbox that often sparks curiosity cultures.
Cultures.
Yeah.
You mean like growing those colorful bacteria in petri dishes?
Mm.
Seems a little old school in this age of like high-tech imaging.
It might sound like something out of a vintage science lab, but
Right.
cultures play a vital role in these infections,
Right.
especially when it comes to choosing the right antibiotic.
Right. You don't want to bring a knife to a gunfight,
Right.
or in this case, the wrong antibiotic to a bacterial battleground. Tell me more about why these cultures are so essential.
Imagine this. You've got a complicated intra-abdominal infection brewing.
Yep.
Cultures help us pinpoint the specific bacterial culprits responsible for the mayhem.
So it's like gathering intel on the enemy before launching a counterattack.
Precisely. This bacterial intel helps doctors choose the most effective antibiotic, ensuring the treatment packs the strongest punch.
Okay, that makes a lot of sense. So when are cultures a must-do in these situations?
The guidelines are quite specific about this.
Okay.
Let's start with blood cultures.
Okay.
They're most likely to be beneficial for patients with more than just a fever.
Okay.
Think low blood pressure, rapid breathing, or even confusion. Those red flags that scream, something serious is brewing.
So it's about like looking at the whole picture, not just one symptom in isolation.
Exactly.
Yeah.
Another scenario where blood cultures are key is when there's concern about antibiotic-resistant bacteria. You want to make sure you're using an antibiotic that will actually, take down the enemy, right?
Absolutely. No point in sending in reinforcements that won't stand a chance.
Right.
So blood cultures, check.
Yeah.
What about those intra-abdominal fluid cultures? Are those always part of the game plan?
Now, this is where it gets interesting.
Okay.
For complicated infections, when a patient is undergoing a procedure like surgery, the guidelines are very clear. Get those cultures.
So during surgery, it's like seizing the opportunity for some real-time bacterial espionage.
You could say that. It's about gathering as much information as possible to make the most informed decisions about antibiotic treatment right then there.
Makes sense you want to hit those bacteria where they live.
Right.
But what about less complicated cases, like uncomplicated appendicitis? Do they still recommend those cultures?
This is where the guidelines threw me for a loop. They actually recommend against routinely doing those cultures in uncomplicated appendicitis.
Really? That's surprising. I would have thought they'd want to be extra cautious, even in those cases.
It seems counterintuitive, right?
Yeah.
But it turns out that in these situations, routinely culturing the fluid doesn't actually improve outcomes.
So it's a classic case of don't fix what ain't broke. Sometimes less is more in medicine.
You've got it. It's about using resources wisely and not subjecting patients to unnecessary procedures if they won't make a real difference.
I'm seeing a recurring theme here. The guidelines emphasize, like, personalized medicine, carefully weighing the risks and benefits for each individual.
Absolutely.
Yeah.
Now, are you ready to delve into some specific recommendations from the guidelines?
Yeah.
We've touched on risk assessment, imaging, and cultures, but there's so much more to unpack.
Bring it on. I'm all ears and ready to be wowed by the wisdom of these guidelines.
Okay, let's circle back to risk assessment for a moment.
Okay.
Remember those scoring systems we discussed earlier? The guidelines actually dive deeper into which ones are most helpful for predicting mortality in adults and children with these infections.
And what's the verdict? Is one score, like, superior to the others?
For adults, if a score is being used, the expert panel gives a slight edge to the APASI 2-second score.
Okay.
They suggest it's the preferred method for risk stratification, especially within 24 hours of being admitted to the hospital or ICU.
So that's the one to remember if you're an adult facing one of these infections. But what about the WSES sepsis severity score? Didn't we say it's specifically tailored to these infections?
You've got a great memory.
Yeah.
You're absolutely right. The WSES score is a fantastic alternative and performs incredibly well, likely due to its specific focus on complicated intra-abdominal infections.
So 2 strong contenders for adults. What about the younger crowd? Do they get their own special scoring system?
Here's where it gets interesting and a little frustrating.
Okay.
The guidelines clearly state there's no specific scoring system they can confidently recommend for children with these infections.
No kidding. That's a tough spot for doctors to be in. What do they do in those cases?
They have to rely on their clinical judgment, taking into account the child's individual circumstances, medical history, and the specific details of the infection.
Right.
It highlights how much art there is to medicine, especially when dealing with younger patients.
It's a good reminder that medicine isn't just about like algorithms and numbers. It's about experience, observation, and that gut feeling that doctors develop over years of practice.
Couldn't have said it better myself.
Right.
Now, are you ready for a rapid-fire round of imaging recommendations?
Hit me with your best shot.
Okay.
I'm feeling like I could ace a medical imaging quiz show right now.
Okay, let's start with those pesky appendixes again.
Okay.
For adults, the guidelines are pretty clear. Abdominal CT scan is your best bet.
Okay.
Highly accurate, even without contrast, and usually no further imaging is needed.
But what if the CT scan results are a bit ambiguous and the doctor is still suspicious? Do they just keep scanning until they find something definitive?
That's where that clinical judgment we talked about comes into play again.
Right.
They might recommend a period of observation, maybe with antibiotics, to see how things shake out.
Okay.
Or, if the suspicion of appendicitis is high enough, they might even recommend surgery without picture-perfect imaging. It's all about weighing those risks and benefits for each patient.
So it's not just about the images, it's about the whole clinical picture. That makes sense. Now, for children with suspected appendicitis, we're back to ultrasound first, right?
You're on a roll. That's right. Minimizing radiation exposure is key, especially for little ones.
Right.
But what if the ultrasound doesn't give a clear answer?
Right.
Back to the CT scan.
Well, they could go that route.
Mm-hmm.
But we've also talked about MRI as an
Yeah.
option, right?
You got it. MRI is another tool in the toolbox.
Right.
And the decision between CT and MRI often comes down to balancing those risks and benefits. Radiation exposure versus the need for a definitive diagnosis for each child.
So many factors at play. It's like a medical game of chess, carefully considering each move. Now, what about those complicated cases, pregnant individuals with suspected appendicitis?
Mhm.
What's the recommended imaging strategy then?
You're already thinking like a pro. You're right. Pregnancy definitely adds another layer of complexity.
Right.
The guidelines recommend starting with an ultrasound, and if the results are inconclusive and more information is needed, moving on to an MRI.
So far, so good. I'm feeling pretty confident about appendicitis. What's up next on our imaging adventure? Those tongue-twisting gallbladder conditions.
You've got it. Cholecystitis and cholangitis. Those tricky gallbladder and bile duct issues. They can be quite painful and require careful diagnosis.
I bet. So what's the imaging game plan for those? Is it similar to appendicitis?
For non-pregnant adults, the guidelines recommend starting with an abdominal ultrasound, just like with appendicitis.
Okay.
If that doesn't provide a clear diagnosis, a CT scan is often the next step.
And if those two tests don't reveal the answer,
Mm.
do they just keep scanning?
That's when it might be time to call in the specialists and consider more specialized imaging tests,
Okay.
like an MR-MRCP or an IDSA scan.
Those sound intense. What exactly are those tests like?
Well, without getting bogged down in technical jargon, these tests offer incredibly detailed views of the gallbladder and bile ducts. Think of them as the high-definition cameras of the imaging world. They help pinpoint issues like blockages or inflammation that might be missed on other scans.
Sounds like you'd want to avoid those unless absolutely necessary. They seem pretty high-tech.
You're not wrong, but it's reassuring to know that these tools exist if needed.
Right.
Now, here's where things take another interesting turn. For pregnant individuals with suspected gallbladder problems, the guidelines don't actually recommend a specific imaging test to start with.
Wait, really? Why not? Is it a data issue again?
You hit the nail on the head. The guidelines acknowledge that there isn't enough high-quality evidence to say for sure whether ultrasound or MRI is the better choice in these cases.
More research is needed. It seems like a common theme in these guidelines, highlighting areas where we still have much to learn.
Mm-hmm.
So what do doctors do when the guidelines are silent?
They have to rely on their clinical judgment, weigh the potential risks and benefits of each imaging test for the individual patient, and have an open conversation with the patient about the best course of action.
Shared decision-making. I love it. It's so empowering for patients to be actively involved in their healthcare.
Absolutely. These guidelines recognize the importance of that partnership between doctor and patient. Now, ready to tackle another infection? What about diverticulitis?
Okay.
Any guesses on the recommended imaging approach?
Well, if I've learned anything from our deep dive today, it's that you can't go wrong with a CT scan for adults.
You're definitely getting the hang of this.
Right.
And you're right. For non-pregnant adults with suspected diverticulitis, an abdominal CT scan is often the go-to imaging test.
Okay, I'm sensing a pattern here. What if, for whatever reason, a CT scan isn't an option for the patient?
Then we turn to those trusty backup singers we talked about,
Hmm.
ultrasound and MRI.
Right.
They might not always be the headliners, but they can be incredibly valuable when a CT scan isn't feasible.
Makes sense. They're always there to step in and save the day. And just to test my knowledge, I'm guessing the guidelines for pregnant individuals with diverticulitis are a bit murkier, right?
You're on a roll.
Mm.
The guidelines don't provide a definitive answer in these situations. They simply state that doctors can consider either ultrasound or MRI, depending on the specific circumstances.
It seems like there's a recurring theme here.
Hmm,
More research is needed.
it seems like it.
It's fascinating how these guidelines highlight both what we know and what we still need to uncover.
Absolutely.
Speaking of needing more research, what about those unwelcome guests? Intra-abdominal abscesses.
Ah, yes, those pus-filled pockets. For those, we're often back to CT scans for adults and adolescents.
And to mix things up, I'm betting children get an ultrasound first.
You're on fire today. You're absolutely right. For kids, it's usually ultrasound first, followed by either a CT or MRI if needed.
See, I told you I was becoming an imaging pro. What about pregnant patients with suspected abscesses? Is it the same story as before?
You guessed it. The guidelines are silent on which test to use first. They simply state that both ultrasound and MRI are options, and the decision should be made based on the individual situation.
More research is needed, as always. It's fascinating how these guidelines highlight both the incredible progress we've made in medicine and the vast amount of knowledge we still have yet to uncover. But back to those abscesses for a second. What happens when the initial imaging isn't clear-cut? Say an adult has an ultrasound that doesn't give a definitive answer, what's next?
That's where those additional imaging options come in. The guidelines suggest that either a CT scan or an MRI could be considered for further evaluation. The choice often depends on factors like the patient's medical history, other health conditions, and even the availability of each imaging test.
So it's a team effort between the doctor and the patient to decide what makes the most sense.
Exactly. These guidelines encourage that shared decision-making, which is fantastic.
I love that. It's so important for patients to feel empowered to ask questions, understand their options, and be active participants in their own care.
I couldn't agree more. These guidelines aren't meant to be a rigid set of rules, but rather a valuable tool to help both healthcare providers and patients navigate these complex infections.
Exactly. A starting point for conversations and informed decisions. Well, I've got to say, this deep dive into complicated intra-abdominal infections has been eye-opening. I feel like I've learned so much, from those tongue-twisting medical terms to the latest imaging technologies.
Me too. It's amazing how much progress has been made in diagnosing and treating these conditions, but it's also clear that there's always more to learn.
Absolutely. And that's what makes medicine so fascinating, right? It's a constantly evolving field, always striving for better answers and better outcomes.
Couldn't have said it better myself.
Well, on that note of continuous learning and exploration, I think it's time to wrap up this deep dive. Until next time, keep those brains curious and don't be afraid to ask those tough questions.
And remember, knowledge is power when it comes to your health.